Thank you for staying with us, and in case you're just joining us, welcome. We are talking matters fibroids as we get to commemorate the Fibroids Awareness Month, which is the month of July that we are actually saying goodbye to. And joining me for that conversation is one Dr. Sarah Mora. Now, before we took that break, Dr. Mora was just cautioning us, because I take that as a caution. You know, there are these concoctions that are sold out here telling you that if you drink them, your fibroids may vanish or they may shrink, and she's just let us know that you may be taking this concoction to shrink the fibroids, but they may be causing problems to other organs in your bodies, including the kidney. That is quite alarming. So can we just get into that a bit, you know?
Yes.
Because as you mentioned, this may be clickbaits and people just finding opportunities to solve a problem, because
Yes.
that's how businesses are started. You
Yes.
solve a problem. You
Yes.
know that many women get to suffer from fibroids, so
Yes.
how about I just get a concoction and sell it to them and tell them that it's gonna heal your fibroids.
Yes.
But none of us really has that at the back of their minds, that I may be taking this, but it may be causing other problems that are not even part of me.
Yes.
Yeah.
And it's important that first I must speak on that, because I do honor traditional medicine.
Mm-hmm.
The problem we had with traditional medicine is apprenticeship died. So no one was handing over the proper way to mix these concoctions and at what levels. Because here's what I want to say to us, that even the modern, what you call the modern day medications, come from leaves and plants. So for example, you put in a concoction that would cause the same challenge as paracetamol. Because when you take too much paracetamol, your liver is at risk. So these concoctions are medicinal. We're not saying they're not. But if you're taking them without the knowledge of the apprenticeship that was necessary to make the concoction, you're causing a problem to the people. Because how do you know what the traditional healer was using if you didn't go to school with a traditional healer? And this has to be discussed, because we're not erasing traditional medicine. Just like the way I went to school for ad nauseam years, because I mean, yeah, you need to be an apprentice of a traditional healer to know how to mix those. Then I agree you can take them, because they're very cautious about those. Secondly, you also want to see how then a manipulator can come in the spiritual angle, because don't forget, fibroids are still considered to be demonic and a spiritual attack.
Really?
Yes, that's one of the biggest challenges, that most people will not come to the modern ways of therapy, because they can be dealt with by a witch doctor, spiritual healer, or a pastor.
In this 21st century?
It is there, and there are many people who are going through that, and the psychological impact is quite massive, because then no one really knows how to address these people who don't have perhaps a way to be regulated. So when now I put a concoction to you and I mix it up and I tell you this is what I did, and let me say this, they do announce that women are the best market. So you have the concoction for your mental health, you have concoction for your physical disease, concussion for your beauty, concussion for your weight loss, concussion from head to toe for the same thing, just a different label. We will have a lot of problems. Remember, statistically, kidney and liver disease is increasing in Kenya and also in Africa. Most of it is because of concussions.
Okay. It had to be said.
It had to be said, because like I said, some of these miracles hide in the medical practice. Some of these failures hide in the medical practice. You finished with whatever concussion you've done and you come to my office with something else, and when I deep dive, I discover at home you have something you are mixing that was pimped by a beautiful looking woman or a very handsome man with eloquence, only for your detriment.
Okay. Right, now it's out there, now we know, you know. When it comes to fibroids, how is it diagnosed? Is it only through the ultrasound? Is that the only way you can be able to diagnose it?
So commonly ultrasound would be the way. And for some, we will take you to the level of MRI, but there are specific things we are looking for that an ultrasound will miss. Ultrasound is the best. First of all, it's fast, it's cheaper, it's accessible. So no one needs to go to a higher level of means to investigate it beyond an ultrasound, unless medically specified. So we do have complicated fibroids, which then will require an MRI to follow through. But
Yeah.
ultrasound is good.
Okay. Let's get to talk fibroids and infertility.
Yes.
I know that you mentioned that as one of the misconceptions out here, but also it can cause or can interfere with a woman's, ability to carry a baby to term and even get to conceive.
Yes.
Let's get into that. So how do fibroids affect a woman's fertility and the ability for them to carry a baby to term and get to deliver their baby safely?
So we're looking at things like size, so location, and so size, the bigger they are, would affect. But we have many women who have given birth with fibroids. So that's why I said it's a myth. We don't see you a patient with fibroids and immediately think, oh my God, infertility.
Could it be dependent on the location of the
Yes.
fibroids?
So the size, the bigger the size in the area where the placenta should attach can cause that. Number two, location, which if it's at the place, if I would explain, I love how the uterus looks like this. So the ovaries are here, and this where my armpits are is where now the uterus joins with the fallopian tubes. So if the fibroid is in one of these places, then that can cause the lack of the sperm to fertilize, and even the egg coming in, fertilized egg coming in back to the womb. But remember, we again said these are things we solve. So just because I now discover the fibroid doesn't mean now we are stuck. We know what to do and how we are going to solve it. And when we talk later about the solutions we do have medically for this, that will be important case. So I really do hear you when you say infertility, fibroid and infertility is paired, but it's not as paired as other things. This is a solution. There's a solution to this cause of infertility.
So there's always a solution for infertility that may be caused by fibroids.
Yes.
That is like a
It
given
is a
for
standard.
sure.
When we find fibroids as your cause of infertility, we dance because we're like, oh, okay, good. This one's going to have small one very soon.
Dance.
Yeah, we're like, good, because the other ones, no, yeah, those ones, they kind of have to bring out the brain matter in you. But this one, we have a solution. We know what to do, how to do it. And remember, now we have medical professions like me who are into the counseling because, again, part of infertility, a large percentage is psychological. So when we go in there and you've already been told fibroids, you don't have a child, you want to have more children, psychologically you're feeling impaired. Infertility does occur. So psychological infertility is what we call it. So once that's out, it's fine. Now, there are some people who contend with how we then surgically deal with it as one of the methods, that could thin the lining and cause infertility. Oh, we are waiting. It's statistically, medically, we speak about that thinning, but people are giving birth. People are giving birth. Yes.
All right. So what happens to untreated fibroids? So say I've been diagnosed, I have the fibroids, and they're now big. They're like big, because I know for some people you can actually like their stomach actually expands, and you may think 10 kg. So your stomach is big, but probably it's not affecting you in any way. Maybe your menses are not interfered with, you're not getting the pelvic pain and all of that, because there are some people who are like that. It just grows, yes, but nothing is being interfered with from the outside looking in, right? So what happens? Is there any danger?
Unless persistent growth, which will then compromise the other organs in the stomach or in the abdomen. Otherwise, no, because some of these things are incidentally found either in pathology, that is death, or they are found when you're investigating something else and okay, she has a massive fibroid. Okay, but then that's incidental. And in medicine, when I say incidental finding, really we try not to major on that minor. So we might come out with it just because the compromise of other organs, but like you mentioned, if there is no heavy bleeding, there is no pain, there is no discharge, there is no recurrent anything in terms of infections or
like
anything
it doesn't
else,
affect your day-to-day.
Nothing day-to-day. But if it affects your psychological, I'll remove it. Because that's another thing we must be very keen on observing with women is psychological effects. She was perhaps a size 10, 12, and now has a big tummy.
Yeah.
And everybody's saying, you know, if it's not affecting you, it means nothing. There is room for that type of surgery being done for that sake.
Yeah. And on the same, maybe for someone who is of childbearing age, they don't have kids yet, they want to have kids, probably they're between the ages of 28, they're about when they want to probably get a child.
Yes.
And they have the fibroids, they're big ones, right?
Yes.
Whereby, but it does not affect their day-to-day.
Yes.
Would you advise that young lady to have the fibroids being, you know, get them off, or they can still carry their pregnancy to term together with the fibroids in their uterus?
I would say remove, because then I'm looking at the likelihood that as more children you give, by more hormonal impact it will have on the fibroid. Remember, its mutation and growth is supported by hormones. The one thing that I also want to caution people is on contraception, hormone contraception. The link is becoming more and more glaring in that, especially the P2, the emergency contraception. I have a lot to say, but this is not the day. We will discuss contraception another day.
Okay.
There's a lot that I want to teach women about contraception, and that does not work for them in this 2025. And part of the things you'll see is with that contraception is fibroids. Yes.
Yeah, we were on the we were talking about, you know, this young lady who wants to have children. They have these big fibroids that are not affecting them in any way.
Yeah.
So you'd advise remove.
She removes them.
Okay.
Yes.
Yeah. Just
she removes them because, again, like I mentioned, with pregnancy, hormonal surge, they're likely to become bigger. And she's young. Let's keep her life as normal as it should be, because that's a space-occupying lesion. So you don't want her stomach to be bloated. Let her wear what she feels comfortable to wear at any time. So that will be my reasoning to remove, that the pregnancy will make it worse, and for psychosocial factors, I would also remove it.
Yeah. So there's the recurring of the fibroids.
Yes.
There are women I know personally who've gone for surgery, have the fibroids removed, 3-5 years later, they're back.
Yes.
You know, like they're growing so rapidly.
Yes.
What causes the recurring, and maybe just how to go about that?
So again, genetically, you're black. It's just that gift that keeps on giving. It sounds unfortunate, but I want anybody who that is occurring to remember these words. There is a solution, and we will tackle it. It doesn't mean that you've done something that other people are not doing, or you haven't done something that people are doing. No, it just means it recurs, and it's something that we have a solution for, and something well planned to take care of for you to go back to living a normal life. So recurrence, just like ovarian cysts, don't bother me unless they become malignant. Yes.
Okay. Let's talk about, I think I've lost my trail of thought, but still on the fibroids, right? And okay, I think that has gone. Let me get into something else, and then that will come back. The treatment options.
Yes.
What are the treatment options available right now?
So far, the classic ones will be to remove the growth itself, which is just the growth, not the uterus. And that's a myomectomy. That's the one most people fear, that it will thin the lining of the uterus. But we are still having successful childbirths post that. And that's the safest option, because it can be done laparoscopically. And like having a huge incision, that is done laparoscopically. The second one is based on 3 things, which is the removal of the uterus. And it's not only the uterus we remove plus the cervix, because that's
when does it get to that?
When they're huge. When they're huge, you're bleeding very heavily. There's no reason to keep your womb. You have 4 children, 5 children. I mean, there's some discussions we'd have, even with people with 2 children, to logically...
For those who don't have children yet and they want children?
We will push that decision. Oh my God, we will push. There will be a panel of 6 or 7 of us before we decide that your uterus has to come out, before you've even given birth to a child. Oh my God. We will even revive you from theater, take you back to the ward and tell you this is the only thing we saw in the abdomen. We have to come out with your uterus. We no longer have those crude, and they were crude in my view, whereby we wheel you to theater to do a myomectomy. and then we find we have to remove your uterus. I will caution anybody who that may have happened is you are either bleeding profusely, which is one thing a surgeon will not take for granted. If you're bleeding intraoperatively and the uterus has to be removed, we come out with it because we want you alive.
Yeah.
Yes.
Okay, so the treatment options are the
The myomectomy, which is just removal of the lesions,
Yeah.
and very successful, so laparoscopically for minimal scarring.
Yeah, so
Then-
that's non-invasive. You're not cut completely.
So they're all
it's just-
invasive,
Okay.
but it's how we minimally invasive, which means we give you just small scars, strategic places, so that unless somebody is really investigating, you can still wear a bikini.
Okay.
Yes.
Yeah.
Then the removal of the uterus. Then there is one that we do that is either MRI or ultrasound guided, minimally invasive again, which we just try and, for lack of a better word, but kill the supply of blood to the fibroid, and it shrinks and dies and just dissolves itself. So those are the methods we use. Currently there are a few studies on types of hormones or pills which can be used to do that, but again those are still studies. High on priority now is we are having psychological counseling, because some of the things that come off after we've solved medically are greater than what the fibroid was causing physically. Yes.
Can they disappear on their own?
Yes. Oh, I've seen many. Like I told you, medicine is very interesting that people don't read books. So we do case-by-case analysis and they do disappear. There are people who are solely determined for you not to do anything. Their patients will tell me, give me 2-3 months, I'll be back. No concussion, no, please. Yes, something else.
It's just
Perhaps their God is what I'm looking at, yes.
okay, but there have been cases where they just disappear.
Yes.
Yeah.
Even with age.
Yeah.
Because if we find them at 20, sometimes the doctor will say, give it time, let's see, it will disappear. And it actually does. Yes.
Right. There's a new treatment option I saw the other day. Maybe I don't have much info on it because it's quite new. I think in Kenya it's only one facility that has it, whereby it's completely non-invasive, like no cuts made, none whatsoever. You just, is it the one you were talking about? You just go under something, the equipment, and then they are, what's the word to use? Like they, zinachomwa.
Yes.
Yeah, like, you know, it's completely non-invasive.
Yes.
Could you talk a bit about that?
So what happens, remember that we are stemming off from oncology, which is cancer. And now oncology is the one that started developing the use of rays, X-rays or gamma rays in terms of healing and reducing the size of tumors and cancerous tissues. So that's basically what they're doing at a lower non-toxic level, because again I want to warn that it's non-toxic levels. They have also measured to see, because again we have outcomes that with those rays that can cause a cancer to come on. So we are careful in terms of introducing that, but yes, it is a good solution because it targets. So what the beauty of that thing is it's targeted therapy. So it targets just where the
where they
fibroid
are.
is,
Yeah.
not the whole system like what we used to do before.
Yeah.
An improvement on management of cancer anyway. Remember, we're not saying it's cancer, it's stemmed off from, if we can reduce the sizes of cancers, we can also reduce the sizes of
the
tumors like
fibroid.
fibroids.
Yeah.
Yes.
So it's still quite new in the country, right? So
Yeah,
but
and
probably
it will pick up quickly because it's a it's a radiology thing.
Yeah.
It will pick up quickly. It's just perhaps what people were waiting for was the machine, because most of these things we know of them, but the equipment tends to be very expensive.
Yeah.
So it will pick up.
Yeah. Okay, let's talk about nutrition. That's what I was looking for the other time when it had skipped my mind. You know, is there something you can eat, or is there something that you're supposed to be eating in order to maybe prevent your fibroids or the fibroids from growing larger?
Okay.
Let's talk, you know, lifestyle changes, nutrition to be specific.
Okay, so one of the things that nutritionally, for me, what I advise, because I'm also an advocate for nutrition against poor nutritional recommendations that are targeted for a specific place. So one of the things that I usually then say, if your periods are heavy and therefore you're losing a lot of blood, then you need to supplement with iron. And by supplement, I mean green leafy vegetables, not an iron supplement, unless I look at your hemoglobin to be low at a level where I need to boost it with a supplement or blood transfusion. So those are the nutritional guidelines I will put. If there's a side effect or the complication, if you like, of heavy bleeding, I would then do that. But then we must then go back to just the basics. Can we have a good carbohydrate? Can we have good proteins? Can we have vitamins and minerals which are found in fruits and vegetables? Can you have a bowl of groundnuts? It's just gonna, like a snack. Have yourself a cup of tea or a cup of coffee. Just live as normal as possible. And this is why I say this. And I know there are many people who have put out things that you can do to help you with fibroids.
Yeah.
But I'm also saying that nutrition is not targeted to one place. It's a whole head to toe business. So get yourself to a place where you're comfortably managing your meals in that area where I've done. Remember, carbohydrates for energy, allow you to think, be on your feet. Proteins for your muscle building is specifically where we are going back to the home science book. Should you remember your home science class? Just that. And then again, nutritionally, I keep saying that your mental health helps a lot. If we start giving restraints on how you eat, which by the way in diabetes we stopped that. You know that we stopped in the major diseases of diet, we stopped having a diabetic and hypertensive diet. So why then would we make fibroid people have specific things? Now I know people have spoken about fat-rich things, diets high in carbohydrates could exacerbate that.
Yeah.
But I'm not convinced because I don't have research that supports that being against. Just eat healthy, as healthy as you can be.
Yeah.
And the Oshamba out there provides quite a lot of the things I've mentioned. Your ugali, so skuma wiki, terere, you know, things that you can get from out there will help you live a very healthy life. Yes.
Yeah. I want us to get back to the treatment options that you mentioned that are available. Maybe one may be watching and they're afraid of that surgery because they don't know the side effects that come with that. If we can talk about maybe the treatment options that you've talked about, 3 of them, and their side effects.
Okay, so when myomectomy means the removal of just specifically centered on the removal of the lesion, which is done laparoscopically, this largest concern will be not necessarily a must, 100% will be thinning of the walls. And therefore when baby then is during attachment and baby growth in the womb, the uterine is likely to rupture if it's thin. But again, that doesn't scare us because if we get you on time and take out the baby at the right time and just reconstruct the uterus, we are okay. Because again, the things that we see about that thinning don't worry us because we have solutions for them medically. Should you get, which is almost 99.99% of the obstetrics and gynecologists are well versed with this, so you're not worried about any other thing coming out from the myomectomy. Secondly is the removal of the uterus and the cervix sends you immediately to menopause. So that is one thing that will be menopause. But hey, chamomile tea, have love surrounding you, just have fun, and some of these things tend to wear off. Because remember, menopause tends to be heavy because of the psychological impact of life that has thrown to you, and then there you are having hot flashes and all that. That will be a biggest concern. Of course, if you have not yet delivered a baby, or you've not delivered a baby, and then we're removing your uterus, the psychological effect of having not given birth would be there. But Look at it this way. A woman becomes a mother regardless of where the children come from.
Yeah.
You can greatly impact people with whatever it is that you need to do for community. So that would be then the removal of the uterus and the cervix. I've seen people who, when the removal of the uterus comes, then sexual pleasure goes down, but the sexual pleasure goes down because we are not doing the psychological aspect of a woman without her womb. Because it still remains in the 25th century that women as young as 20 still identify themselves with their womb. So we haven't won in the separation, and I don't think we should ever separate a woman from that, but we should win in terms of how we walk through with women who have lost the womb for various reasons when they were unprepared. So those are the side effects that we commonly see. And of course, again, recurrence, even if we remove by myomectomy, which is removal of the specific lesion, it could recur. And then somebody will be like, what? We did everything we could. How come? And I'm reassuring you today, should anyone be in that situation, that don't worry, we'll just do another myomectomy and we move on. You get it? We move on, because I feel like we build monuments on trauma and pain. There's a solution for us to move on from this. So no one should be, oh, we have a fibroid, and be afraid. I think the biggest side effect or complication is the misunderstanding of what a fibroid is. And we have demystified that today.
Yes, we have. We have done that today. And by the way, I don't know if we've talked about this. Are there medication for fibroids, you know, before we get to the treatment options that we've gotten to speak about, whereby now it's the removal? Are there tablets, are there syrups that someone may take to maybe shrink them, or?
So these are in pipeline in terms of tablets, which are hormonal, and they're in the pipeline. So I'm not eager to say much about them, because again, we don't want to perpetuate something we've not carefully studied. Because again, this is my concern in such things with black women, is that when we have not done much research on things on black women, we later on find other complications that we did not want.
Okay.
And the list is long. Even the way you're nodding, you know what I mean. We've come with solutions for black women in poorly researched areas, and then we've had other problems ahead. For example, Ozempic.
Wow, that's a whole discussion on its own.
Thank you.
Yeah.
Yeah. So for black women, we're as delicate as they come. And if you're a black woman listening to me and you have fibroids, you're as delicate as they come, but we have as many solutions personalized to you, and will work with you to the end, to whatever your success is. So don't take it too personally.
Okay.
Yes.
I know when you mentioned Ozempic, and yeah, maybe I know what you're saying, but probably there's someone who's watching and they're like, Vivian, let the doctor say what they want to say concerning Ozempic, because maybe it's something they're considering. Maybe just something small on Ozempic.
Something small on Ozempic is one of the biggest challenges we are having. It's the liver and the kidney effect it's having. Number two, the facial changes that occur. Number three is the rebound weight gain should one stop. And number four is actually, I don't know who is not saying what, but the sexual desire change.
Okay, there you have it. And this is a conversation that we may plan to have maybe
Absolutely.
later on, because as at now, then we have come to the end of this conversation. And I love the way you've put everything into detail. You know, I believe that you have gotten us into matters fibroids, and we have, I mean, we've done justice to the month of July, you know, whereby it's the awareness month, and I believe we've created enough awareness just from this conversation. So thank you so very much for joining us. And maybe if you have your last remarks, that's your camera, you can speak to directly to a lady who's watching us right now.
Yes, thank you so much. It's such an honor to serve. But if you are a lady and you know a lady who's going through this very temporary season of having fibroids, I want you to know that having people who hold your hand is a priority, because medically we have a solution. Should yours have complicated, not to worry, we still have solutions for that. Please, as soon as you discover that you have fibroids, seek medical advice, not friend advice. We are available wherever you'll be able to find us. Doctors are well trained and equipped to deal with this. And don't forget your mental health in this journey, because this, again, a fibroid could just be a new chapter for a new and better you.
Thank you so much. It was a pleasure having you grace our program today. So thank you for honoring our invite.
Thank you. It's such an honor to be of service.
Amazing. This is where we get to call it a wrap on the show today. Thank you so very much to each and every one of you who has been watching the show. And you know, I'm sure you've gotten so many takeaways from this, but the main takeaway should be that fibroids is curable and it should not affect your day-to-day, because there's a solution for it. So if you know someone who has fibroids who may not get the opportunity to watch this show today, just let them know that there's a solution and they don't need to despair just because of fibroids. This is where we say goodbye. My name is Vivian Dagwa. See you next time, God willing.